My name is Mark Frankle. I'm a shoulder and elbow surgeon in Tampa, Florida. Over 20 years ago, patients who had shoulder problems, including severe rotator cuff tears and arthritis, had limited options to improve their life with regards to the comfort and the function of their shoulder. This is usually a result from either traumatic or more commonly degenerative conditions. Patients were often told there was little treatment that they could have. There might be surgical options to reduce the patient's pain, but had little ability to improve their function. The innovative treatment called reverse shoulder replacement was introduced about that time. It utilized a biomechanical principle of improving the stability of the shoulder joint by placing the ball where the socket should be and the socket where the ball should be, allowing for a stable platform for the muscles that were still functioning about the shoulder to power the arm to improve function. Since the introduction of that innovation, patient care has been transformed. The care of patients who previously had no treatment options now can anticipate a relatively predictable improvement in both comfort and function with the use of their shoulder. Things such as daily hygiene, cooking, cleaning one's house, and recreational activities such as golf are now realistic goals of patients who previously would have been disabled. Since the introduction of reverse replacement in the beginning of the millennium, the advancements of reverse replacement have included an expanded understanding of indications, improvement in design, and improvement of surgical technique. In the year 2000, in the United States, there was one center with one surgeon who performed 100 reverse shoulder replacements. In 2021, it's likely that upwards of 80,000 patients will undergo reverse shoulder replacement throughout the United States in multiple centers by multiple surgeons, thus attesting to the improvement of shoulder care with the innovation of this type of device. The improvements have been substantial both for the patient and society, but there are still several unsolved problems that are still continually being researched. Problems such as instability that can occur even after a reverse replacement, or fractures that can occur in the shoulder blade related to some unforeseen stress in about 5% of patients. And finally, optimizing designs to maximize patient's function depending upon the structural damage that may vary from patient to patient. The advancement of reverse shoulder replacement has been funded primarily through manufacturing companies and various research institutions, but has been limited to funding from National Institutes of Health. The ability to continue to improve our patient outcomes can be accelerated with more research support. Ultimately, this research helps patients around the world. Here's a patient of mine who was given consent to share their story. He's a wounded warrior who was referred for disabling pain as his only functional extremity. His daily life was limited by pain and lack of function. We performed a reverse shoulder replacement, and this is him just 2 months after his surgery. Thank you.
Giving you some idea of my range of motion and how things are going. You know, I've got just about all you would hope and expect. I do experience a little fatigue and lack of strength when I push out with this arm or when I pull in with this arm, or when I do some repetitive action above the shoulder, which is to be expected. I am really amazed at how I've progressed. I'm able to do things that I had kind of written off my list of things that gave me pleasure and were going to be beyond my reach, such as working in my shop or playing in the garden or whatnot. I am very pleased, and it was good to talk to you and understand that I can continue to expect some improvement over this length of time. One other thing that I'm amazed at, what kind of scar is that? I'm not going to get tattoos, but this looks like something on someone's face. Your people did an excellent job at that. I'm extremely indebted to Dr. Greg Jones for referring me to you. Have a great day.